Hi, my name is Manya Sikka, and today I'm going to be presenting my research on teens' perspectives of e-cigarettes versus traditional cigarettes. There are four main topics I'll be covering in this paper: marketing tactics, perceptions and influences, mental health, and then possible solutions. So our overall research question is, what are teens' perspectives towards e-cigarettes and what factors contribute to this perspective? For some context, e-cigarette use among teenagers has increased by 47% in the past 5 years. E-cigarettes are battery-powered devices that are also known as vapes, which heat a liquid into an aerosol, which the user inhales. These were introduced in the 2000s, but they gained a lot of popularity in 2015. This started the trend of youth-targeted marketing and high nicotine delivery. Although e-cigarettes can be seen as having less of an effect than traditional cigarettes, that is far from the truth. E-cigarettes pose a lot of harmful risks for teenagers, specifically because of nicotine's really harmful effect on the developing brain. So through this paper, we aim to summarize the current literature investigating teens' perspectives and risk factors for e-cigarette use. So starting off, marketing tactics. A big factor that impacts how e-cigarettes are perceived by youth is the implementation of various colors and flavors in the design of the e-cigarette. A large study, including 1,500 participants, had participants complete an online survey where they had to rate their perception of, or their perceived risk of different packaging. So packaging would have more colors and flavors, and packaging would have warning labels and symbols. What they found was that the positive themes of those flavors and foods reduced the risk perception. However, anything that drew a comparison between e-cigarettes and traditional cigarettes increased the perceived risk. Another study took that even further by presenting high schoolers with 3 products, 2 which had warning labels and 1 which had a flavor label. In this study, the warning symbols increased risk perception, which shows that using flavoring in foods and advertisements and packaging with a lack of risk statements can skew the way young adults perceive the effects of e-cigarettes. Beyond colors and flavors, however, another factor that contributes to the accessibility and appeal of e-cigarettes is the marketing techniques companies use to spark interest in youth. Researchers in Scotland performed observational audits of retail stores and found that 36% of stores had e-cigarettes placed near products popular to children, including confectionery, cards, mints, gums. This increased exposure may contribute to the normalization of e-cigarettes in the eyes of children. In fact, other research has shown that 78% of middle school and high school students reported having been exposed to at least one advertisement for e-cigarettes. In addition to marketing, they also have increased access. In a study that was conducted across 30 US cities on youth between the ages of 13 to 20, researchers found that youth may have increased access to e-cigarettes via online websites with lax age verifications, delivery services, or even shipping products from an older friend's house. If students are surrounded by others who use them, they may end up desiring e-cigarettes due to peer pressure, and obtaining these e-cigarettes is easily attainable. Now on to perception. An additional factor in the rise of youth e-cigarettes is the belief that it is a safer alternative to traditional cigarettes. In a study conducted with 1,500 students, they found that current youth vape users reported greater perceived benefits, lower risk perceptions, and greater positive expectations of e-cigarette use compared to traditional cigarettes overall. They additionally found that 66% of youth who prefer vaping over smoking marijuana believe that vaping was healthier, supporting the fact that youth have misconceived perceptions. In fact, a study done on 3,170 students from 4 Connecticut high schools revealed that students are not aware of the high nicotine percentage in Juul pods, with most students indicating that Juuls contained low nicotine. Another study expanded upon this, where they gave a group of 443 youth non-smokers 3 different products: marijuana, e-cigarettes, and cigalikes. Vapes which were in the form of cigarettes, the cigalikes, were perceived as higher risk compared to the traditional forms of e-cigarettes. Conversely, vapes in the form of traditional e-cigarettes, which do not closely resemble cigarettes, were perceived as less harmful. The lack of education surrounding e-cigarettes and vapes can lead to teenagers to harbor false beliefs, which may ultimately lead to adverse health outcomes. Another factor that impacts teenagers' likelihood of using e-cigarettes is how the people around them perceive e-cigarettes. It's well established that teenagers are highly influenced by the thoughts and behaviors of friends around them. One study showed that teenagers are also highly influenced by peers' opinions when it comes to e-cigarette usage. Conducted in South Central Texas schools, researchers found that most teenagers felt their parents would strongly disapprove of their vaping, but were less certain that their friends would disapprove. This suggests that as e-cigarette usage becomes more popular among youth, it may become more socially acceptable and less stigmatized to vape. A combination of peer pressure and normalization may cause more teenagers to become active e-cigarette users. Another prominent factor in e-cigarette use is mental health issues in adolescents. A recent study surveyed more than 3,500 university students on their usage of e-cigarettes, drugs/alcohol, and mental health issues. In this study, researchers found a strong correlation with recent use of e-cigarettes and lower self-esteem, alongside greater symptoms of anxiety, PTSD, ADHD, and impulsivity. A 2023 umbrella review involving 6 systematic reviews with 85 total primary clinical studies also found that increased depression, anxiety, and impulsivity were significantly associated with e-cigarette usage. Though these studies do not establish causality, these associations suggest a strong link between e-cigarettes and adverse mental health states in youth. Moreover, studies have shown that nicotine can worsen the effects of depression and anxiety in youth. More research needs to be done to characterize the risk of youth turning to e-cigarettes as a coping mechanism in the setting of mental health struggles. In fact, a recent focus group study found various ways to help combat the rise of e-cigarettes based on student impact. Researchers interviewed 8th, 10th, and 12th graders. And those students answered that stress and mental health can have a severe impact, stating that a decreased emphasis on grades and class rank and addressing mental health stigma would help all youth find other resources to cope besides e-cigarettes. More high-quality studies with large student populations are needed to better characterize the dynamic between e-cigarette usage and mental health. This paper has covered many factors that may lead to the increased risk of using e-cigarettes among teens. There are several possible solutions to combat these factors and help teens make better choices. One major way is to protect teens from using e-cigarettes by providing them with more education on its adverse effects. For instance, in one study, students voiced their beliefs that additional education and information on e-cigarettes would prevent many students from using these substances, as they may not be aware of the effects these substances have. Another study done in 2024 found that there are many different smoking cessation programs that could also help in preventing vaping in youth. This review summarized the current literature on teens' perspectives regarding e-cigarette use and identified many key risk factors. As e-cigarette use has skyrocketed in recent years, urgent work is needed to help teens make healthy, educated choices. Their adolescents are exposed to a range of influences, including marketing campaigns by e-cigarette companies, peer pressures, and misinformation. However, the success of evidence-based methods addressing tobacco, smoking, alcohol, and drug use provides a blueprint for tackling this challenge. By gaining a better understanding of the risks and educating teens with proper information to make healthier decisions, the growing public health concern of e-cigarette use among youth can be mitigated. Thank you.